this segment, I'm going to discuss implant therapy with you. Over the last few decades, implant therapy has become a huge part of dental therapy, and it's become extremely predictable. So why should we be talking about implants? What are they? What do we use them for? Well, in a lot of cases, people have to lose teeth, either through trauma or disease, and it is not advisable for a patient to go through their life with missing teeth. It can affect their jaw, their function, their aesthetics if it's in the front. So we have to replace teeth. Historically, many years ago, the only way we could replace teeth was to make a little plate with teeth stuck on it that would flip in and out of the patient's mouth. They're still used today in a lot of places, but it's the least acceptable for patients. It's uncomfortable, doesn't look natural. Even the very best removable appliance is not as acceptable as having something that's permanently fixed in your mouth. So that leads to the next item or treatment that we have used to replace teeth, and that would be bridges. So what we used to do before implants is if we had teeth on either side of the space where people were missing teeth, we would drill them down into little stubs, put caps on them, and fused to either cap was the phony tooth. Now they're still used today, and in some cases they are still the primary choice, particularly if done well. But in a lot of situations, why would we want to do that? We don't want to drill healthy teeth down if we can help it. If a person already had old crowns or big old fillings next to a missing space, well, you can put a bridge in there and feel a little bit better about it. But I know for myself, if I had to lose a tooth, I wouldn't want the teeth on either side drilled down to put a bridge in. So that's where implants come in. So what really is an implant? It's basically just an artificial root. It's a tiny little piece of titanium that is placed into the jaw, and once it has integrated into the bone, we can build whatever we want onto it. We can put a cap on it, we can put a bridge, we can do a denture, whatever we find is necessary to bring the patient's teeth back to normal. Now, implant placement, though, is a very specialized therapy. Anybody can drop an implant into the jaw, but the key for success, both functionally and if it's going to go in the front aesthetically, is proper treatment planning and design so that implant is placed in the exact position. So when the restorative dentist like myself comes time to be placing a crown or whatever restoration, I know it's in its proper position. As a result of that, I refer all my patients to a clinician that actually specializes in the placement of the implant. It's typically a periodontist. Oral surgeons are also okay to do this. As I have lots of training and specialties in a variety of restorative concerns and issues, the periodontist also has a variety of options when placing implants. There's a lot of diagnostics that become involved, CT scans, diagnostic stents, etc. The message here is we don't want to take any shortcuts with implants. It's like the foundation to your house. We don't want your teeth or your house sitting on a rocky foundation. So once the implants are placed and we're all happy, they're all solid in your mouth, you'll come back to me and it's like you having a root in there, and now I can work with my lab and the patient and we can design whatever the appropriate restoration is so you can end up having a long-term predictable result. So if you're a patient who is a candidate for implants, then why don't you set up a consultation with me? I'll sit down, I'll go through all the options, I'll refer you to the appropriate people, and hopefully we can end up getting the result that we all want.